All right, all right, all right. Hello, everyone, and welcome to another podcast here on Trifactor Engage. If we haven't met yet, my name is Elle Adda. I am the chairperson of Trifactor Engage as well as Breakthrough in Action. Super excited to be launching Breakthrough in Action. If you haven't heard, it's an interactive workshop series where we bring in amazing researchers and doctors and psychologists like the amazing woman that you're going to meet in just a few moments together, where we curate content, practices, frameworks, and tools, as well as a community support system to provide those who are experiencing challenging times during COVID, but who also want to step up and take ownership of their well-being during this time. So, ladies and gentlemen, I'm so excited to introduce you to a very dear friend, an amazing person that I've learned so much from already. I'm really looking forward to bringing her onto the show. She is, of course, a board certified psychologist, a PhD in psychology, and she does a lot of different work with a lot of different organizations and individuals in helping with the treatment as well as overcoming their struggles in life through creative art therapy and a lot of other different mediums as well. So, ladies and gentlemen, Dr. Ellen Agustin. Welcome, Doc.
Hi, good afternoon, Elle. Thank you for inviting me in this Trifactor Engage. Yes. Okay.
How are
So
you today?
also I want to say good afternoon, good morning, good evening to everyone.
Exactly. So wherever you're listening from, Doc Ellen is joining us from the Philippines as well. How has your quarantine been, Doc?
Yeah, just okay. I actually have a lot of me time. You know, if you're really practicing the mindfulness, you will enjoy the free time. But of course, not everyone is like us into that kind of activity, right?
Absolutely. But I think it's one of those, there was a time when I wasn't into that activity as well. The whole me time, the meditation, the journaling, spending
Yeah.
time on the breath work, because I was in that mindset of go 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 go. Time is money, or you gotta make sure that you work hard. And you can sleep when you're dead. I bought into that whole mentality, and I think the culture scheme where we spend more time on our careers than we do on ourselves is catching up to us, because at the end of the day, yes, it's wonderful to pursue all these big things, but we need balance. And same thing right now, as we're in the middle of crisis and adversity, regardless of how great our health is, we need balance. And Doc is going to give us a little bit of scoop on that magic balance and tell us how we can incorporate practical tools at home.
Yes, I am actually introducing Elle with what do we call the psychotherapy? Because a lot of people are not actually aware of what is psychotherapy.
Yes.
And then also, I want everyone to have this full grasp of what's really the meaning of mental health and how it is important to us. So yes, we are now in this pandemic, but you know what? Mental health is not only during this COVID-19 concern, but this is something that it's a lifelong skills that what I hope they will learn a lot from today, because this is something that they can use in everyday life stressors, something like that. So to start with, of course, I am actually into it. So I love this topic because this is where uh, uh, I'm actually seeing myself most of my, days love doing a lot of meditation. So I'm into this practice. But of course, when we talk about psychotherapy, we are actually talking about a lot of stuff. Okay. And of course, for today, I'll be discussing some of the important practices in which our, audience can apply that particular, say, therapy at home, especially nowadays, because I know that not everyone's like us, that we can, a sudden stop we can really decide right away that, oops, okay, so meaning this sudden stop, meaning we have to be, into the state of meditation, okay? But for others who are actually not used to it, so it's a different thing, okay? So to start with, I want everyone to have this, what do you call that? Psychotherapy. I want to have a good understanding is how applicable, because a lot of people are, saying, Doc, what is that psychotherapy all about? Because I heard a lot of that many people are so, they have that fear of going to psychiatrists, psychologists, because they really don't know what they will do that in that particular clinic, except that what everyone knew is that they are fully aware that yes, the school have guidance counselors,
Yes.
right? Okay, so psychotherapy for everyone's knowledge. So this is in general term. So treating mental health. So problems by talking with a psychiatrist, psychologist, or other mental health providers. So it's a talk therapy. So you can be yourself all the time. And then during the psychotherapy, it is important that you learn your conditions. Yes, it is important, very important. And your moods, your feelings, your thoughts, and behavior. Psychotherapy definitely helps you learn how to take control. Oh, that's the word. That's the key word there. Take control of your life. Okay. So, and of course, it is important, just like what we are experiencing now. It is important that we learn how to respond to this kind of challenging situations with a healthy coping skills. Okay. So actually, there are a lot of psychotherapy. So each with its own approach. So the type of psychotherapy that's right for you depends on your individual situation. Okay. So psychotherapy is also known as talk therapy, counseling, psychosocial therapy, or simply therapy. So that's psychotherapy.
Excellent.
And also for everyone's interest, because maybe your question, maybe what are the kinds of mental illness? But you know what? I think the topic today is not really discussing the mental illness, but this is more of the, uh, the typical normal anxiety that we are experiencing every day, right?
Yes.
But for everyone's info, of course, psychotherapy can also help those people experiencing anxiety disorders, some types of disorder, mood disorders, addictions, eating disorders, personality disorders, and schizophrenia. I I gave you that because for you to have that question in mind, that what? By just talking to a psychiatrist or psychologist, that can treat these kinds of disorders? Of course. Okay, just to give you a historical background, for us to have that scientific basis, where is the psychotherapy came from? So 7,000 years ago, okay, there was actually what you call the trepanation kind of treatment, wherein, there is what they call a drilling small holes in the brain. Can you imagine that?
Look at the pressure.
Yeah. So there's a pressure. So there will be a drilling small holes in your brain. Oh my gosh. So what will happen to your beauty then? Okay. So while trepanation and other surgical methods before, such as lobotomies, have unsurprisingly fallen out of favor because, of course, nobody wants to do that, right? Okay, so there is another approach that was 7,000 years ago. One that has been both celebrated, scorned over the last century, is the psychotherapy. So meaning to say what? By just talking, we don't need to go under that, having that small hole in the brain, we can be treated. Yeah.
I think that's fascinating because it's like you said, our vision, even with neuroscientists, the more research that's being poured in, the more the more time is being passed, the more we're learning about our capabilities to actually change the function of the human brain. And for so many years, up until about maybe like a decade ago, we thought that once the human brain is like that, it's like that, and you can't really do anything about it. And that's why, they did these ridiculous shock therapies to be able to just to change it. But we highly underestimated the power of the human mind, and how psychotherapy and literally just talking about it, not talking about it because Doc Ellen is going to be hypnotizing you, talking about it because there is such jumble, and I know this because I speak from experience, the amount of clutter that's in our heads that a lot of the times don't actually make sense or are not valid, but we don't know that they're not valid because they've just been in realities in our head and they've been stuck there until
Yeah.
we actually we actualize them on paper, and in the way that we express ourselves, or to a psychotherapist who will guide us to be able to first understand before we can rewire. So I love that you're going to be able to share with us. And again, like what she said, it's not about mental illness. One, there's nothing wrong with you. We all have mental conditions, regardless if you're 3 years old who's running in a field all happy, or if you're someone who's barely getting out of bed. We all have mental conditions, and is our personal state of well-being that is affected by our surroundings, our biology. And I cannot say how much I appreciate that you mentioned how each therapy or each treatment or each practice needs to be tailored to an individual. And that means that we spend time trying to get to know ourselves. So, Dr. Ellen, can you explain, because I understand how I thought this before. It seems very vague, you know, I can't touch it. I can't understand it. You can change the brain with your mind and just talking. So can you give a couple of examples, maybe from your experience with your students or your clients, of how you've been able to see this expression and this conversation be able to make fundamental shifts in their mindset and in their reality?
Yes. Yeah, that's actually, you know, your best question ever. Your first best question ever. You know why?
Ask
Because,
a lot
you
of
know,
questions.
there will be a lot of questions.
Yeah.
You know what? There's nothing that I like really better than when I actually helping an anxious or depressed person. You know why? Because whenever I'm actually helping an anxious or depressed patients or person, that then I see that patient feels happy again. You know what? Even if you actually help one single person, mind you, Elle, that positive impact for that particular person is immense. That's why I love psychotherapy.
I'm so glad to hear that. You can see it in the way. I don't know if you guys like notice or not, but Dr. Ellen is glowing.
Well, thank you. Yeah. Okay, so I would like to proceed now because this is a very interesting topic. Because I mentioned, right, that there will be that 7,000 years ago, that there is actually that kind of a kind of treatment. Okay, but of course, so how is the talking therapy become, become a treatment of mental distress? Okay, so because 300 BC, okay, it was Socrates' time. Okay, it was Socrates' time when his students actually engage, okay, in the philosophical group discussions, and then now known that it's actually known as Socratic Dialectic method. Okay, so these group discussions were used to help people better understand their universe and their purpose. Okay, so that's a very good thing, right? So that is what we call the contemporary psychotherapy. So we're in from that particular conceptual framework that links the knowledge of the mind and the brain. So that's a very good take off of the psychotherapy. So this is more of creating ways of understanding the self and treating our mental health condition. And of course, after that, definitely a lot of researches actually prove that yes, psychotherapy really helps a lot of people. So I have here at least two examples, okay, for our audience to be appreciative of the psychotherapy. So it says here that ongoing anger and stress are major contributions to high blood pressure and number of related health illnesses. Okay, so that found that psychotherapy, by just talking, produced the same level of systolic blood pressure reductions and anti-hypertension medications. So it's more of calming your body, Elle. So it's very good. So, and then also there is another research here. So where we can prove that psychotherapy really exists and help a lot of people. There is what we call here the meaning-centered group psychotherapy, wherein this has been shown to reduce the psychological distress and improve the spiritual well-being in patients with advanced terminal cancer. Okay, so that's very helpful. Okay, so later I will be discussing a lot more of the, that the common diseases nowadays wherein this psychotherapy is very applicable. Okay, but of course, so what about those people experiencing normal anxiety? Okay, so for not everyone who benefits from psychotherapy is diagnosed with mental illness. So I want everyone to know that. Psychotherapy can help with a number of life stresses and conflicts that can affect anyone. For example, this can help you. That can also resolve your conflicts with your partner or someone special in your life. And psychotherapy can relieve anxiety or stress due to work or other situations around us, just like now, the COVID-19 concern. And then psychotherapy cope with major life challenges, like for example, divorce, death of loved ones, or say now, the loss of job. We all know that a lot of people lost their job. And then also psychotherapy you can learn to manage unhealthy reactions. Wow, I love this because this is something very applicable to say road rage or how are you going to understand those people around you with a passive aggressive kind of behavior, Elle? Yeah. So, and then come to terms with an ongoing serious physical health. Yeah. So, meaning to say, by just talking, you will have that kind of full awareness what you're actually going through. Example, those people suffering from cancer. Yeah, I mentioned that. Those people with diabetes and those with people suffering from long chronic pain. Okay. And also, psychotherapy will help us recover from physical or sexual abuse. That's why oftentimes this is actually being used in some of the centers for girls because this is very applicable because especially I'll be mentioning later the kind of therapy wherein if the client or the patient are not, into that state of wanting to share, yeah, the art therapy, the expressive art therapy, and plus this kind of talk therapy, we can actually get a lot of from that patient. Okay, then this also can help, say, treating your own insomnia, sleep better. Because if you have trouble getting sleep or staying asleep at night, I don't know, LB, but you know what? Personally, as a psychologist, even if I'm fully aware that yes, yes, we are having this concern, and I am a psychologist.
Yes.
I can still, I will not have this kind of say experiences just like other people. But you know what, El? Just to be honest with you, I don't know why. Like for example, previous week I actually experienced this kind of concern.
Mm.
I have this difficulty falling asleep,
Yeah.
where in fact that's actually past my bedtime already.
Yeah.
So that's my question. So what's happening with me?
I'm supposed to know the answers.
Exactly, because yes, that's actually what I told myself. I'm supposed to know the answer because I'm a psychologist. Because you know what? Yes, I'm fully aware, but physiologically,
Yes.
because we're used to be very, very active prior to the pandemic.
Yeah.
We're so busy attending a lot of stuff, and then all of a sudden, the sudden stuff. There you go.
Absolutely, and I think that's a really, really important point because it's not necessarily, we have to understand that the state of our mental well-being is not always just dictated by whether or not we have any suppressed feelings or whether or not we're going through a mental disorder or anxiety or depression. Sometimes there's so many different moving parts and variables to the food that we eat. Was there too much sugar, or did you have a glycemic index insulin crash, or was are you experiencing a little bit of lethargy because maybe something you ate it had a little bit of inflammation? It has nothing to do with whether or not you have daddy issues.
Yes. Yeah.
But I mean,
remember,
yeah. And so, it takes so many decades for us to be conditioned into this way. And, no wonder we only access 10% of our brain, because that's all we can handle for right now until we actually, put ourselves to practice. But there are a lot of different reasons. And one of the things that I'm so excited for Dr. Ellen to share with you is, as she said, when we experience these stressors, to develop the discipline of not engaging in them, but to develop the discipline of mindfulness and observing them, so that we know how to react. Because at the end of the day, our well-being is all, we're constantly choosing our thoughts and our emotions. Whether we're habitually choosing them or intentionally choosing them is the question. So, Doc, can we just scroll back a little bit and explain why is it that the human brain is wired to dwell on the past or worry about the future? Why are we conditioned to make up these illogical realities or stories in our heads that actually create these self-limiting beliefs that then, really weigh down on our mental and physical and emotional well-being?
Yes, because that's what it has something to do with our neurotransmitters, and it because what our body is made up of biological, right? And definitely what is happening in our brain has something to do with the biological, the effects of the biological component. Yeah, I'll be discussing that later on, but that's basically the basis of why we do love, attending to past events, where in fact we have to, put that, not really forget about it, but there should be a mindful acceptance of that. But it's the biological makeup, and of course the life experiences, it's important to take note of that. It's yes, I mentioned the neurotransmitters that has something to do with the wiring of the brains and the biological makeup and the life experiences. So that's three. So meaning to say, regardless that you have the full acceptance of what happened to you in the past, and then the question there is, it keeps on going back from time to time. There is what we call flashbacks.
Yes.
Okay. Oftentimes we have flashbacks because of the neurotransmitters or the component of our brains. And oftentimes we said that, yes, in full awareness, we said that we forget about it. But unconsciously, subconsciously, it's actually stored in there. And the biological makeup of our body is something that is actually or not under our control. So meaning to say, regardless of, but of course, even if we will have that flashbacks, and even if we will have that concern about the neurotransmitters, the wiring of the brains, because definitely nobody can stop that, or even nobody, nor no medicine can really say, now stop, I don't want to look back anymore on the kind of traumatic experiences. But wait, those are things that not under our control. But the moment, that our biological component, the wiring of the brain, so that has something to do with the neurotransmitters, will give us that kind of flashback. Okay, you just go back. That's why there is a psychotherapy. Have that kind of mindful acceptance that, wait, there is something physiologically happening in my body because of that biological makeup of mind. However, I can control this by being fully mindful, aware of where I am now. Okay, so that's the only thing as a psychologist that I can say you can help yourself by pulling yourself from that kind of flashback.
Yeah, that's excellent.
You okay with that, Elle?
That's perfect. It kind of completely sums it up, because it is confusing, and I think that's what causes so much confusion and unrest and like resistance within us, because we don't want to be saying or behaving in certain ways that we behave and say things. We don't want to be thinking certain thoughts. We don't want to be, feeling certain feelings. And then it makes it feel like, well, am I not supposed to be in control of myself? Is there something wrong with me? And it always goes back to that. What's wrong with me? And there's always that conscious fear. It's all because we never learned how to cope with our feelings as children. And so we literally just either we ignored it, or we distracted it with something else, or we tried to cover it up with something else. It's like, when you're a kid and, you say, someone invites you to their house and says, oh, do you want to watch an episode of the Teletubbies? I don't know why I said that. And you said, oh, who are the Teletubbies? And then they say, oh, you don't know who the Teletubbies are? And all of a sudden, as a child, you feel like, wait, why don't I know who the Teletubbies are? Like, is there something wrong with me? And then
did you miss something?
We either try to compensate for that in a different reaction, where we try to act more than who we actually just are. And so we see, and this is something that we talked about in the last podcast, is like how this young child is writing the system that is operating our brains, and that stays with us. And that, that's kind of unfair if you think about it, because we decades later, we're like, why do I feel like this? But at least, now that we have the awareness, I love what you said, how you can say with mindfulness practice, you just say, you know what, stop. There is something going on physiologically, psychologically. There's a reaction with the hormones and all of that. I have to just acknowledge that and take that pause. And so then it takes away from the whole, people have this stigma with meditation and the hippy dippy and the new age. But at the end of the day, coming from yourself, extremely well-educated PhD in psychologist, and the fact that you've seen this time and time again, witnessed throughout your clients, that it's really just a state of giving us the pause for us to come back to baseline and not be swept away.
Yes.
That's awesome.
Because that's actually what we are, helping our clients with in terms of psychotherapy. But in terms of, if you really want to have control of that particular, say, the neurotransmitters, the biological makeup, something, the best to answer that are those psychiatrists, because they can prescribe medicines. Psychologists are, what we're doing really is doing the talk therapy. So we're not supposed to give, medicines or prescribe medicines for our clients. So that's why if in case our clients say experiencing a disorder, and then I'll be doing a psychotherapy with a client, I have to ask, and then the behavior, I cannot really contain the behavior of the client. And then something is, or say, in my mind, I have to, ask a partner psychiatrist for that particular. So for the psychiatrist to give the client or patient, we call that a kind of medicine that to really control the behavior. Okay. But for everyone's information, the psychotherapists or the psychologists are not not prescribing medicines. Okay. So we're doing a lot of talk therapy. Okay.
I think the talk therapy is fascinating. Obviously, if you guys are listening and you do have medical condition, we're also not saying that, like Dr. Ellen said earlier, each individual needs their own personal treatment. The only way to find that out is to dive into self-awareness, or to spend the time in stillness with a professional to figure out what you need. So there are some people that do need treatment and medication, and there are some people who are able to cope with natural therapies like psychotherapy. So please, if you're watching, we highly suggest that you, before trying any therapies, that you first be able to consult your doctor. But moving forward with psychotherapy, I mean, some of you guys, if you've listened to this podcast, know that I was diagnosed with ADHD and a severe anxiety disorder in the past, where I would feel it physiologically. My heart rate would go up. I'd get into this tunnel vision. I'd start feeling the surges of panic attacks. And there was a time back then, I would take a Valium, or I would take a Xanax, and that would help mask the symptoms. But at the end of the day, it kept coming up. The reason was because I had a lot of unresolved issues. I had a lot of things that I had neglected or avoided or had not actually faced myself with. I didn't know how to handle my emotions or regulate my emotions. Back then I thought I was my emotions. And that's if you think that you are your emotions, you guys know the crazy things that we come up with in our heads. Doesn't make you feel very good about yourself, does it? But that's where I was operating from.
Yeah, you know what, LD, but oftentimes we are actually hearing this statement. If you have that self-awareness, you are actually halfway through your what do you call that? Wellness.
Yes.
Okay.
Mm-hmm.
So that's the best thing to do talaga.
Absolutely.
You have that full awareness.
So,
Okay?
Doc, how can self-awareness sounds like such a tall order? What does that mean? You know, some people can say like, well, I'm aware of myself. I know that, you know, these are my hobbies. I know that I love my family. But what else is about self-awareness apart from the things that everyone can easily see?
Okay. So that is actually when we talk about self-awareness, I'll be giving you now the mental health. Okay, so let's define mental health, because when we talk about self-awareness, let's define now the mental health. Mental health, this is more of, this one refers to psychological, emotional, and social well-being. Okay, so when we have what you call that, when we talk about well-being, this is something about you are happy, you are contented, you are in a state of healthy kind of mind. Okay, and then for a while, excuse me, 2 minutes.
Oh, go ahead.
I just plug in.
Oh, that's all right. Okay, so Dr.
Okay, I'm sorry, I forgot. Okay, anyway, so let's go back there. Okay, so I'm discussing now the mental health. So mental health, that actually has something to do with your psychological well-being, emotional, and social well-being. When we talk about the psychological well-being, Elle, you know what? When you have that, if you feel happy, contented, psychologically, meaning that you have that self-awareness, okay? There you have that self-awareness, because having that self-awareness is that, meaning to say, you accepted your own strength and weaknesses, okay? And then, despite of the deficiencies and also your, what they call that, your, regardless of the past behaviors and your wrong choices before, you accepted everything. So that is what they call self-acceptance.
Excellent.
Okay?
Let's repeat that one set. So despite deficiencies.
Yes, despite deficiencies, regardless of past behaviors and the wrong choices, there is what they call self-acceptance. Okay?
And that's, I think, I think with everything that we go through, whether it's positive mental well-being or people who've gone through traumatic experiences or people that have gone through addictions, the end stage is always acceptance that we see, because when we find acceptance, then we can release ourselves of everything that's weighing us down.
Very true.
But the process of self-acceptance, as we know, is so complex.
You need a lot of work.
Yes. So how do we get to that stage of self-acceptance?
Yeah. Okay. So of course, for us to have a full view of, yes, because I mentioned the psychological well-being, because this has something to do with your anxiety and depression. I want really to explore psychological well-being. Yes, you have that self-acceptance, and you need to have that under the psychological well-being. You need to have that, what they call that, the autonomy. The autonomy has something to do with self-reliance, and then with that self-reliant, you don't worry much about what other people will tell about, will worry about much what other people think about you. Okay, so you don't care about those stuff. And also, if you are psychologically healthy, or you have that psychological well-being, meaning to say you have that positive relationships. Okay, positive relationships, because it feels, you feel loved, respected, and connected with all those people around you. And of course, definitely, you feel so secured in all kinds of relationships. Okay? So can you recall that when
Yeah.
if you are psychologically well, meaning to say you have that self-acceptance,
Have
autonomy,
autonomy,
and
despite
positive
and social well-being.
relationship. And positive relationship.
Yes.
Okay, and then of course,
I feel
you
like I'm
need to
gonna
have
quit
what they
here.
call you need to have the personal growth.
Yes.
Yeah, you need to experience, of course, personal growth. Being psychologically healthy and happy, you need to experience that personal growth because the personal growth will help you increase your learnings about a lot of things,
Yeah.
like this one, by
Let's take,
listening to this.
let's take a couple of steps back. You said social well-being.
Yeah,
And we
yeah,
also heard that, we mentioned that self-reliance means that we
yeah.
can be confident in ourselves without worrying
Mhm.
about what other people think. So I just want
Yeah.
to address a fine line here about social well-being, consideration of other people, and contribution and
Yeah.
connection and support, and the balance between that and being confident enough in ourselves that we do not need
Mhm.
the approval of others. So
Yeah.
how do you make sure you're balancing equally in between the two?
Yeah, I'm actually, thinking about the keyword there. You know, okay, so, right. So you will not be more of self-critical because you know what? Oftentimes, when you are actually hearing a lot of stuff from other people, you have the tendency to become self-critical. Whatever you hear from other people saying, what can you say something negative word?
A negative
Yeah,
word about
coming
my
from other people say,
yeah. So if they're saying that, Elle, you talk too much.
yeah, something like that. And then example, you don't have that. Yeah, you're focusing too much about your environment,
Mm.
about their concern about you. So
Mm.
meaning to say, a lot of people, you know what? At the end of the day, when they go back to their homes, parang they keep on thinking about it, repeating it. Yeah, and then so how can you say you are balanced if you really cannot control
Mm.
those kinds of hearsay? Say, I don't know if that's hearsay or you hear that directly from a person.
Mm.
If that keeps on repeating,
Absolutely.
say yes, yeah. So definitely you are not in control. So meaning to say you really cannot control those factors in your environment. Being self-reliant meaning whatever is happening around, yes, there is keyword, mindful acceptance. Oh, Elle said that. Hmm, I am so talkative. Okay, so I'm so maingay. Okay, so with that, but for other people that is negative for them.
Yes.
Okay, and
Mm.
then so how can you control? How can you say, I will not mind those kinds of, say, negative criticism about me? So again, what you will do? Okay, you sit down. Okay, but you just give yourself 1 minute or 2 minutes. Okay,
Yeah.
just relax and then bring yourself into full attention that I will not be controlled by those words. It
Mm.
is my choice if I'm going to entertain that kind of, I say, negative criticism, or I will give myself value because I know myself more than they know me. Okay. Is that okay with you?
Absolutely. And I think that goes to say as well with not only the words that you hear from other people, but sometimes the hardest
Mm,
words are the words that we tell ourselves.
true. Because you know what, Elle? Oftentimes, that is what they call an additional to those negative criticism that you heard from the outside. Okay, so meaning to say, when you are alone, you add some more. You're adding some more negative self-talk. That's what we call negative self-talk. You just heard one word, but you try to magnify it.
Mm.
By magnifying it, only to find out that it's only one, not only one word, but yeah, it became say 4 or 5 negative self criticism.
Yeah. And the
Something like
funny thing is that, not the funny, because it's really rather sad and
that.
painful,
Yes.
but because we're so used to going through that loop. And when we say
Mm-hmm.
like we're adding some more, it's not just the fact that
Mm-hmm.
we're adding some more. There's actually a biological um, frenzy that is happening when we react to those negative thoughts. And so our
Yes.
focus, where focus goes, energy goes. Our focus and energy
Yes.
goes into that thought, and it is draining, and it
Mm-hmm.
invokes this like fight or flight response. And so all of a
Correct.
sudden we can't think clearly. You know, you've ever been in that
Yeah.
space where, you know, you're so angry that you can't think clearly at all. You can't think clearly about a problem.
Mm-hmm.
You're not going in the right direction. You're falling down and you're clumsy because your body is
Correct.
literally, we are so
Reacting.
impaired. We get
Yes.
impaired when we are
Yes.
stressed or when we are in that state. And
Yes.
when we the worst part is when we get
Mm.
used to it, anything with repetition becomes a habit. And so
Yes.
if it's repeating all the time and those neurons are constantly firing together, the brain is like, I'm going to be more efficient. Since these are always
Yeah.
firing together, I'm going to wire them together. And then that thought pattern becomes something automatic.
That's
You don't even have to
conditioning.
try. Yeah, that's conditioning.
Yeah.
And we don't
Yes.
know. And we don't actually know that we have it. We have conditioning with, and it boggles my mind because this is just a, you know,
Mhm.
with my recent journey, it's
Mhm.
a very, it's very late in my life that I'm learning these things when I wish I learned them in school. How we have so much conditioning, doc. So
Mhm.
explain how this conditioning, not just with negative self-talk, but with
Mhm.
with everything, and the way that we interact with people, the way that
Mhm.
we treat our relationships, or the way that we work with our productivity, how this conditioning has shaped our reality. How serious is this issue,
Yeah.
and what can we do?
Yes. Okay. What can we do? Okay. Of course, basically, we have to have, when we have that full awareness, that self acceptance, we need to be aware also. Do you really have a purpose in life? Because by knowing that you have a purpose in life, definitely you can fight those kinds of fears.
Hmm.
Knowing that my purpose here is really not for myself. It's not for the reason that, uh, yeah, I have to get up in the morning for someone, special someone, or for my family. But the purpose should be, what is that kind of life transformation for you?
Hmm.
Remember, that's psychotherapy. And going back to that, when you have that kind of flashbacks, remember, I mentioned that whatever you are experiencing while you are in therapy, or while you are treating yourself, or while you are doing something for yourself, biological has something to do, which is not under our control, in the life experiences will, are actually still working hand in hand while we're doing the therapy. So meaning to say, those flashbacks, those kinds of mental wiring that is happening that you really don't understand, that has something to do with the two things, biological and life experiences. Because those things actually cannot be taken for granted, they're just like that.
Yes.
Okay? That's why in psychotherapy, the only thing that you can do is that you just go back to the now. Okay,
Yeah.
you just feel the present. Okay, because it's important, because we really cannot say 100% I want to forget the past.
Yeah.
We really cannot do that. Okay, that's really part and parcel of our human life experience.
Hmm.
Okay, so give you more, yeah, because I still have lots, yeah.
Yes, please.
Okay. So of course, our mental health, this is our ability to process information. So there is a saying, yeah, I love this one. There is a saying, it's not always a bed of roses. Because as you can see, when we go back to the, say, early on, uh, we keep on, going back. Why is it I'm having this kind of mental rewiring and all of those kinds of flashbacks, etc.? Because certainly the ability to direct one's mental energy is, it should be in a positive direction. Okay, so that's psychotherapy. So because uh, going to a positive direction, that is very essential in our emotional health. Because remember this, our true emotional health and mental health requires one, us to accept, process, and respond to the things that are not always pleasant. Okay, so that's my answer to that questions that why I'm having a lot of flashbacks. I still go back to those kinds of painful memories. So meaning to say, one must have acceptance, one must process and respond that, you know, every day is not always a bed of roses. Okay, and also it is important. So maybe the questions of our audience would be so what does good mental health looks like? Okay, so I want everybody to be aware that having a good mental health is not, okay, bold letters, not, NOT, is not living without problems. Okay, take note of that. It is important because acceptance is the word. Having a good mental health is not, again, feeling jolly 100% all the time. So we cannot be always happy, Elle. We cannot say that as we get up in the morning, you're 100%, yeah, energized up to the end of the day. So it's not like that, okay? Having that, what do you call that? Being mentally healthy is not always having a positive thoughts, because you know it is important to note that we really cannot be as positive as always, you know. It's human nature. Sometimes we react to things, especially with those environmental factors. It's so, you know, spontaneously we really cannot say stop. You're a psychologist. Stop, you're doing mindfulness. Stop.
You can't control other people who are going to drop in on your day and be like, hello, surprise, here are some stressors and demands.
Very true. Also, being mentally healthy is not, okay, being perfect. I love this, Elle, because I want everyone to love their imperfections. Yeah, that's basically being mentally healthy. Yeah. Do you love that? Loving your imperfections.
It's beautiful because it's so difficult.
Yeah, true.
Because it's
but it can be learned.
Yes, it's what I think, and that's where the self-acceptance comes in. I think it's because we understand the law of impermanence in life, that things are never always going to be, you know, good, that things are never going to be the same, but also the law that, you know, for anything to grow, it must break.
Correct.
For anything to progress, there needs to be a fortifying in that fire, and that's something that we often try to run away from or try to avoid because it's not comfortable. But I think it's only because we've shifted our mindset into thinking this is uncomfortable. And the practice is what, I mean, it's still hard. I still don't want to wake up in the morning and you know, run 25 miles or 26 miles for a marathon. But once you get started, it's literally fighting those impulses not listening or reacting to that. Because once you actually do get started, or once you're in the thick of the challenge and you know with your intention why you're going through the challenge, because it is your identity and you were equipped with that and you were comfortable in yourself, then it becomes something beautiful. Then your challenges or your weaknesses become these launching pads for how you're going to learn and develop into this beautiful, authentic self.
Correct. And that intention with conditioning is perfect. It's a perfect combination, right?
So there's bad conditioning, and we can actually make good conditioning. So how do we make good conditioning?
Yes, we have to emphasize that. That should be good conditioning. Okay, so let's go back again to that self-awareness, because I want everyone to appreciate, to have that appreciation that having a good mental health, now that we all know that we cannot be perfect, okay? Having a good mental health does mean you have that high degree in terms of self-awareness again. Okay, so that's very important. Having that degree of high good mental health, meaning you are being in tune with your emotions, your thoughts. Okay, so you have to every now and then you have to check on yourself. Like for example, you're hearing something negative from the say outside your home, you have to check yourself. What am I thinking about it? What am I feeling about it? Okay, because you know what, at the end of the day, you don't have anybody around you except yourself. That's why I said you have to love your imperfections,
Yes.
because you have to process it with yourself and nobody. Because say you have your own psychologist or psychiatrist. Your own psychologist and psychiatrist cannot be with you 24/7. You
Exactly.
have your best friend, right?
Mm-hmm.
And we have the love of our life, but then definitely they cannot be with us 24/7 a day,
Mm-hmm.
right? Okay, so what we can do, so because I always believe that whatever you joy you feel inside yourself, that can be multiplied when you're talking to other people, because it just goes out naturally. See, so meaning to say, you can have your own kind of healing. Okay, so you don't have, you don't need, I'm not saying we don't need a lot of those people around us. Of course, those people are very important in our lives. However, it is important that you have to be mindful of your actions, your thoughts and behaviors, because your thoughts, behaviors, and actions that can also affect other people.
Yes.
Okay, so also we have to recognize what they call that a mind and body connection.
Yes.
Okay, going back to your previous question a while ago, I forgot to mention there that yes, the mind and body connection has something to do with because you mentioned that we're eating sugar, we're eating, something that will, spite something that has something to do that will affect our behavior. Okay, so you know what? Nowadays, I don't know if a lot of us are actually aware that we have what we call a nutrition psychology, because when we talk about the mind and body connection, it has something to do whatever we eat. Yeah, whatever we eat, definitely that has something to do with our moods,
Yes.
behavior, actions. Okay, it can affect. So that's actually what I mean with mind and body connection. Okay, so for everyone's info, because yes, we are now having this pandemic, I want everyone to have that just a simple definition about when to use the word anxious and depressed. Like for example, if I'm not a psychologist and I don't have any background on this, maybe most of the time I can say, even if I'm worried of something, maybe I can use the word, oh my gosh, what's this happening with me? I'm so depressed. Okay. So meaning to say, for everyone's info, anxious and depressed are oftentimes used interchangeably. Okay. But for the benefit of our audience, I want you to have what we call uh, during the casual conversation. I want you to use anxious and depressed uh, in terms of what you call that specifically. Okay, so meaning to say, anxiety and depression actually they have this biological underpinnings. Okay, so again I'll mention, because that's very important for us psychologists and psychiatrists, the importance of biological and experiences. So meaning to say, we experience differently. Okay, in this way, when we talk about anxiety and depression, we're actually considering two sides of the same coin. What? What is that? Two sides of the same coin. Because as I was saying, when we think of anxiety, we also think about depression, right? People we don't have knowledge in terms of when to use the word anxiety and when to use the word depressed. Okay,
Yes.
so before I'll proceed with that, giving you what you call the markers, the physical symptoms of anxiety and the depression. I want everybody to have what you call that, because it's actually in our title. Don't forget about it. The resilience.
Mm.
Because that resilience really supports emotional and mental health. Why is that? Resilience, meaning to say, to stress isn't about whether or not to experience or feel stress, okay? But how you respond to stress, okay? So
Yes.
that is resilience. So fortunately, so one can build resilience in doing to so support not only stronger emotional and mental health, but stronger overall well-being. Okay? So, okay, let's go back to that word anxious and depressed. Okay, because I want everyone to have that just a basic definition of that, the full understanding when to use the I'm anxious, I'm depressed. Okay, so the term anxious and depressed gets thrown around, especially during the conversation. Okay, so anxiety and depression share a biological basis, as I've said. Uh, Persistent states of anxiety or low mood, like those experienced by people with clinical anxiety. So later on, I will discuss where is the boundary of the normal anxiety and
Mm.
that what they call the clinical anxiety. Uh, Involves changes in your favorite word, neurotransmitters,
Yeah.
okay? The functions in our neurotransmitters. Okay, so meaning to say, the low serotonin levels that are thought to play in both, okay, when we are experiencing anxiety and depression, that will go along with other brain chemicals, okay? The brain chemicals such as that, the word dopamine and epinephrine. Okay, okay, yeah. My actually saying it right, yeah, yeah, that's it. Okay, so what are actually the mental differences between anxiety and depression? Okay, anxiety and depression have distinct, okay? They have distinct psychological features. Their mental markers or symptoms, it is important to take note of this, are different. Okay, so what are the mental markers of anxiety? People with anxiety, okay, worry, okay, they worry about the immediate or long-term future. And people with anxiety have uncontrollable racing thoughts, okay, every now and then about something going on, going wrong, rather.
Are you
So,
reading my diary, Doc?
wow. So, are these the words written in your diary?
I think it explains like a lot of the times, why we can't shut this thing off. It just has a mind of its own, literally.
We almost forget that we are actually on live, El. We're just like we're talking on, yeah, we're just talking casual.
Yes.
I actually forget that we are on live.
Oh
Yeah.
yeah. No, but I think it's important to understand, like as you said, Doc, like mental well-being
Yeah.
is not about us never experiencing those struggles. Because
Correct.
we all have certain brains and the biology of our
Mhm.
brains. I know the biology of my brain is predisposed to racing thoughts, and it's like what you
Correct.
said, the reactions. Like what do we do? Do
Okay.
we get swept away with it, or do we go, okay, hang on a minute, hey, you up there, slow down, okay, I'm in the driver's seat.
Hi,
Doesn't always go that way. That's how I'd like it to go, though.
Are you excited? I know you're listening to me attentively. Okay, so yeah, I mentioned that. Oh, of course, you have to take note of this. You have to avoid situation. I mean, those people experiencing anxiety are actually avoiding situation that could cause anxiety. You have to avoid situation that can cause anxiety. Now that you're fully aware that most of the time that you have that racing thoughts. Okay, so of course, the extreme side of this is those people having, extreme anxiety or experiencing extreme anxiety. This is something sad. So they think about death because in the sense of fearing death, due to the example during this pandemic, okay, the perceive of danger, okay, so the physical symptoms of, say, the COVID, because a lot of us are actually feeling that kind of physical symptoms, the psychological symptoms of having that we are having already the COVID. So that anticipation can be a dangerous outcome of this, having this kind of anxiety, okay? So that's for the mental markers of anxiety. What about depression? So mental markers of depression. So when people are actually having this feeling depressed or feeling hopeless, okay, because people having depression, they are actually assuming that nothing positive, okay, nothing positive will happen in the future for themselves. That's why they are so hopeless, and they believe that it's not worth trying. So I don't want to move. It's not worth trying. What else? What for? Something like that. And most of the time, people who are so depressed, they feel that I feel so worthless. Okay?
Yes.
Yeah, something like that.
So what does it explain the thought pattern? Because most of the time, even people who we see are so confident and are so loud and yell out, "This is me," and I'm proud of it.
Yeah.
So many times, a lot of our deep-seated issues and struggles come from that lack of self-worth or self-reliance. So can you explain maybe an example of a thought pattern that goes to that same landing point of, or feeling not good enough or unlovable or not worthy or not efficient or feeling deficient?
Most of the time, of course, we will not admit to other people that we are weak, right?
Nor to ourselves.
Yes. And most of the time, remember, Elle, we're wearing masks, right? A lot of masks. For example, now you're in front of your friend. You're wearing a different mask. You're in front of your family. You're definitely wearing a different mask.
Yes.
But what my question there, Elle, is who is your true mask?
Yes.
Your true mask, you can only wear that if you are alone. Because when you are alone, when nobody sees you, that's the only time that you can tell me and that you can, you can tell yourself, this is Elle. Okay. So, meaning to say, Elle, why are we experiencing that kind of situations that a lot of people are actually, they projected themselves that they are so confident, they don't have problems in life, that they have that full self-worth. Yeah. But it's the other way around. What's happening? But when they go home na, a lot of things are actually happening in their head. Because this time the mask actually, you're actually removing the mask.
Yes.
That's what we call the social mask. Okay. Because definitely no one will admit to anybody that you have the certain weaknesses.
Yeah.
Okay. So meaning to say, who are you, Elle, when nobody sees you? So that's the only time you can say and admit, yes, this is Elle. And you know what? How can you do that, Elle? Do you know the secret there? How are you going to discover? Do you want to know?
Of course. I think our viewers want to know. Why are you keeping us in suspense?
Yes, because like for example, but you know what? But of course, when we're doing therapy, it is important for us that we have to have the truest of ourselves. Yeah, because that's the end goal of the therapy, that you can go back to the truest of yourself. Okay, because we really wanted each one of our clients to really take out the mask. Okay, but you know what? If you are alone, say you're alone, and then outside you're pretending that you're so confident, you do not have problems, family problems, love problems, and then when you're alone, oh my gosh, a lot of people actually, they don't appreciate me. A
Mm.
lot of people look down on me, something like that. So meaning to say, what the best thing that you can do there is that face yourself in the mirror, Elle.
Yes, yes. I love this exercise.
Yeah, did you try that?
Yeah,
Have you tried
it
that?
was it was one of the telltale indicators in the beginning of
Yeah.
my diagnosis, when I realized I really had self-worth issues. When I looked at myself in the mirror and I said a few phrases about me being worthy, um, which, you know, my fiance wrote for me, and that's why it's so important to have community connection, because they will remind you the good in you even when you don't see it. And I remember just
Correct.
they were reluctant to come out. It just didn't resonate, and that's when the light came on.
Yes. And you know what? And doing that mirror therapy, yeah, that's mirror therapy, L. Because in gestal therapy, we're actually doing that. So meaning to say, when you did that, something's actually happening in you, right? Did,
Hmm.
did you have that kind of experience?
Absolutely.
Yeah. And then, meaning to say, that's the truest of yourself. You don't wear any more masks. Okay.
Mm.
The more when you process yourself alone, and then when you go outside the next time, El, that confidence in you that you are actually projecting to a lot of people is no longer the mask.
Yeah.
Okay. But that's the truest sense of yourself now. Okay. So meaning to say, that's your authentic self. Okay. Meaning say you were able to process yourself. Then most of the time you don't have that kind of difficulty in terms of I'm like that outside. I have to project to be like that outside. When I go home now, then you will cry a lot and then you don't want to look at the mirror. Was there a time that you don't want to look at the mirror, Elle? Because you will definitely discover that you are not actually you're not actually friends with yourself.
Mm. Yes.
Yeah. Because you know what?
Absolutely.
A lot of the clients are like that. Because you know what? In therapy, I want everyone to experience that. Feel first yourself. Because knowing yourself, because yes, like for example now, yeah, we're talking. To whom you're talking, L, is the physical Ellen, right?
Yes.
And the one that I'm talking to is the physical L.
Yes.
But if you have the self-awareness, meaning to say, you are aware and I am aware, both of us are aware that we're not just physical, but we are actually have that spiritual. Okay. So that's what we can discover with the mirror technique.
Mm.
That you can appreciate that you are actually two in this body.
Mm.
Okay. And definitely when you happen to discover yourself, you will not have that kind of difficulty in terms of decision making. Why I said so? Because meaning to say, when you have that connection with your spiritual self and the physical self, you will no longer having this difficulty in terms of decision making, like I have to do that because it is a requirement. Oh,
Mm.
yes, but I'm not comfortable. So meaning to say, your mind and your spiritual self, I mean the body and
Yes.
your spiritual self are not in one.
Mhm.
So that's the secret. Okay.
And can
So
you just talk to our viewers through a simple series of steps that they can do for mirror therapy at home?
yeah, yes, they can do that. For example, just like the mindfulness therapy. Okay. Um, for that mirror technique, of course, for a lot of people, you can actually start this mirror technique later on. Say after this podcast, what you can do just what can you can do lang is you just face yourself in the mirror. But you know what? When you're facing the mirror, you're not going to look at your whole face, okay? The technique there is that you have to look at the black or the brown of your eyes, okay? Meaning to say you will not be mindful about your eyebrows, your face, your cheek, your lips. So meaning to say you have to focus on the brown or the black of your eyes, and then you can, simply you can call your name first.
Yes.
Say, "Hi, Elle, how are you today?"
Mhm.
And then with that, you can start a conversation with yourself. Because you know what? When you do that, especially if this is your first time to do that, a lot of my patients actually experience something different. They said that, you know what? I actually have this kind of, for them, it's a kind of feeling that most of them actually cried
Wow.
because they realize that they're not fully aware that, full awareness that they have that spiritual self inside them. Okay? So meaning to say, they're not fully aware because most of the time, especially if you are busy, what we are aware is that, yeah, it's the physical body that is actually moving, but we actually forgot someone inside us. Okay, that's why we feel what? Unloved,
Yes.
unworthy, because you don't have that self appreciation. So meaning to say, when you do that the mirror technique kind of thing, you face yourself in the mirror, look at your eyes, and basically say something, or say one or two affirmations or
Yes.
words, mantra, that you can use your basic mantra. I don't have you don't have to think a lot of, adjectives for yourself, just the basic. You just tell yourself that, "Hi, today is the beginning of the day that I will discover you." Something like that. You know what? It's magical, El. I really cannot explain, but it's so magical that,
Absolutely.
from head to foot, a lot of things will happen in you. Yeah, it's very magical.
Fantastic.
Yeah.
Let's and I'm glad because I know that now we're going to delve into creative expression and
Mm.
creative therapy. And that's one of those things that I really hope that you guys do try this at home, and to be able to look at
Mm.
yourself in the mirror and have that time with yourself to just
Mm.
sit. The world can wait. All of the things that's on your
Yeah.
mind, that's still going to be there when you're done. But just take that time in stillness. What's the worst that could happen? Nothing, you don't find any
True.
improvement. Great. You're back to exactly where you started. But there's something
Correct.
about speaking words over yourself audibly
Correct.
and setting intentions. Because when we set intentions, when we actualize things onto paper, when we speak about them
Correct.
in front of peers or community or a psychotherapist, we are actually being accountable to the words that we
Correct.
say. And we, by saying them, because that's something we're putting out into the world, there's a
Yeah.
sense in our part of us that knows that we need to take ownership of that. And so when we look at ourselves in the mirror and we
Yeah.
look, it's just you and yourself. And so who are you going to lie to, really? And so it's a beautiful, honest experience. So I hope you guys will try it, and please let us know how that goes. All
Yeah.
right, Dr.
Yeah,
Ellen.
I want to use that word. They can use that mantra. Yeah, when they face the mirror, you can just tell yourself, "You know what? You're beautiful. You're awesome."
Yeah.
Something like that.
And if you can't think of
Yeah.
a mantra, honestly, it's really fun to ask a really close friend or a relative or just someone who knows you a little bit to write one for you.
Correct.
But sometimes it can be
Yeah.
difficult to write your own. I know I started with one written by a friend, so that's something you can try.
Yeah. And also, yeah, I forgot something. Yeah, you mentioned actually the, yeah, what is that? Yeah. You mentioned that, yeah, should be audible. You know why? Because that's actually the secret of psychotherapy. Did you
Yeah.
know that? Because the more that you are hearing things from yourself, you can easily process, and you're hearing it. When it goes down here, it become more lighter,
Yeah.
right? So
Yeah.
that's the
It's the
secret of
processing. Yeah.
psychotherapy.
hmm What other
Okay.
creative expression or creative art therapies can we incorporate at home?
Okay. So we also have what they call the self-help approaches, and that can also be under the self-help approaches, right? Of course. One, so we have now the mirror technique. You can also use that at home. Two, you can also read books, self-help books, of course. You can also you listen to the podcast. I don't know if a lot of you here are actually loves to listen to meditation. Do you love that, Elle? Because
I love
me,
it. I like guided meditations. I like simple meditations, transcendental meditations. I think it's just one of those things. It's difficult during, but anything worthwhile is challenging. But afterwards, it
yes.
just resets. There's something about it that just resets the autonomic nervous system, and you're a different person from when you started.
Yeah. Yes, it's true. It's difficult if it's your first time. But
Mm.
you know what? My suggestion there, Elle, is that when you're having difficulty understanding the meditation, especially for our audience today, yeah, at least now I'm back with live. Okay, especially for the audience today, uh, you just try to, you just play it on. Okay, don't mind if you will fall asleep, or if you will do something, because after hearing that so many times, your subconscious will tell you, hey, listen to this, because this is the best part of that
Yes.
meditation, something like that. Okay, so of course, let's go back. Okay, so psychotherapy, of course, the psychotherapy actually has lots of what do you call that, treatment for depression and anxiety problems, because these are several types of talk therapy. This is structured for everyone's info. And of course, like the cognitive behavioral therapy, so the treatment approach for anxiety and depression can vary slightly for the anxiety or those people experiencing anxiety and depression. So CBT will teach you how to work with unhelpful, what we call that, thought traps. That's what we call that. Okay. And for other problems, CBT is likely to zoom more behaviorally. Okay. For anxiety, the goal is to minimize, okay, avoidant behavior, and to help you disconfirm a feared consequence. Yeah, that's basically for the CBT. And also, yes, I mentioned the CBT. I want to mention also the other type of therapy here. We also have this psychodynamic talk therapy. What is it, psychodynamic talk therapy, aside from the CBT? Because the psychodynamic therapy actually this is a sessions for anxiety
Mm.
and depressions that may look more alike this time. Unlike with the CBT, the application of CBT for the anxiety and depression slightly vary a little. But when we do the psychodynamic talk therapy, uh, treating anxiety and depression are more likely alike than different. Okay, so you will be asked to speak freely and the past, regarding your past and your present, in order to become aware. Yeah, that's the key word in psychotherapy, for you to become aware of your unconscious thoughts
Yes.
and also conflicts, your underlying symptoms that you keep for years already. Oh yeah. Okay, so here is another kind of therapy, because yes, at the beginning I actually mentioned the creative therapy,
Yes.
but I'm going to introduce to you an art therapy used in conjunction with other psychotherapy technique, like the, group therapy and CBT. Okay, so I would like muna to share some historical background. How important is this art therapy? Because you know what, maybe the audience will ask, what? By just drawing something, by
Yeah.
just using pen and paper?
Yeah. How does it make
Uh,
sense?
right? So how can you treat our anxiety and depression with that? Some historical basis, of course, of the art therapy. People have been relying on the arts to communicate. Yeah, that was long time ago already, to express themselves and heal. Okay, the word is heal. So for thousands of years, um, but art therapy doesn't become a formal program then until 1940s. Can you imagine? We just discovered art therapy
Yeah.
recently. Okay, so doctors, of course, then noted that individuals suffering from mental illness, again, and other can express themselves in drawings and other artworks, wow, which led many to expose or explore the use of art in healing strategies. I love this because since the art has become an important part of the therapeutic field and used in some assessment and treatments techniques. Okay, so the use of art therapy methods to treat psychological disorder. Wow, this is good. And enhance mental health, meaning to say you can enhance your mental health by just drawing something. Oh, okay, so let's go further. So art therapy is a technique. So this is actually rooted in the idea that creative expressions can foster healing and mental well-being, the happiness. Art, either creating it or viewing others' art. Wow. It's used to help people explore emotions, develop self-awareness, cope with stress, boost with self-esteem, and work on social skills. That's why, remember, when you're actually attending this artwork, diba, when you look at the art pieces, wow, it brings something. It actually brings healing. Yeah. Have you experienced that? Me, kasi I really love artworks. I love paintings. I love nature. So when you are, yeah, yes, it's very true. When you're looking with other people's work na, and then suddenly there's something that is, processing at the back of your mind. Na parang, yes, there's something, yeah. Parang it brings back memories sometimes. Okay.
That's the beauty of art. I mean, that's my first and foremost profession is as a composer and a director. And what I've always loved about music wasn't just about creating something that was pretty or something that sounded nice, but the intention of art, however aesthetic or pleasing to the eye it may be, the intention of art at the end of the day is to provoke movement in people, to communicate something. And when we create art, it means that we are communicating. And in order to communicate, we have to first make sense of what do we want to say? What do I have within me that I can bring into life? And things come out that we weren't aware of. Same thing when we see a beautiful movie or a beautiful painting, and it speaks to us, it moves us. There's a message of communication, and it provokes. I think the most important thing is that it's not just entertaining. It provokes something within the artist as well as the viewer. It makes them reflect and think. And that reflection and thinking, yes, we're always thinking, but intentional, mindful reflection and thinking. That's where we start asking questions. And when we start asking questions, we start giving answers. And most of the time, those questions are about ourselves.
And take note of this, Elle. People do not need actually to have an artistic ability or special talent, yes, to participate in art therapy. Mind the audience, and people of all ages, yes, including children, teens, adults, and can benefit from it. So some research actually suggests that just the presence of art can play a part in boosting the mental health, okay? So the technique here is while we are using the art therapy, can include drawing, painting, coloring, sculpting, or collage. Okay, as clients that they can create the art, they may analyze what they may have made out of it. Okay, it will make them feel good, and also through exploring their art, people can look for themes, right? That's what I mentioned earlier on, and conflicts that may be affecting their thoughts, emotions, and behaviors. Because at the end of the day, the goal of art therapy is to really utilize the creative process to help people explore self-expressions. And in doing so, of course, this is about finding ways to gain personal insights and develop new coping skills. Okay, it is important really to discover coping skills. Let's go back to the COVID thing. Okay, because yes, you asked me na, what can people do? What people can do at home, especially nowadays that we're experiencing this COVID concern. Yes, they can express themselves in terms of the art. Okay. You know what? Like, for example, if we have viewers like parents, yeah, because I happen to have clients who are actually parents, and then during this pandemic, they really don't know how to process their kids' emotion. And then what I actually told them is that you just get pen and paper, you ask your kid to draw something, and then you just sit beside them, and then you can do some questioning. You can do what do you call that? Process questions. Well, what are you doing? So can you describe what are you drawing? Something like that. Okay. So this is for me is very effective. For those type of clients who have say children at home. Okay. And also as parents, this is also effective or beneficial for us. Why is that? Because in doing so, in having that kind of art therapy at home, mean to say you don't have to visit your doctor, especially nowadays. It's not we're not actually allowed to go out. As a parent, you're helping your kid as well. You're actually helping your kid and you're helping yourself. Why? Because uh, by having that kind of art therapy, you can process the question. Plus, you will become more aware of his or her feeling about the situation. So that's very basic. That's very simple for others, but this is very beneficial for everyone. And say for adults, how is it applicable? You know what? You just draw something. Like for example, you have to combine it with your mirror technique. Okay. So and then you just sit in one corner and then you just get a pen and paper and then okay, Ellen, so what are you thinking today? Yeah, you just draw something lang. And then you can just ask yourself, oh, okay, oh, I think this is, spontaneously.
Yeah.
Yeah. You can have what you call that. You put your mind in it. Okay, you don't have to be very structured. I have to draw a person, I have to draw a house or something like that, right? You just be very spontaneous. It's just like, you know what, because one of the creative therapies as well is the dancing and the music, because it actually involves the body movement. Okay, so meaning to say doing that art therapy, there is what we call a body movement. Okay, so meaning to say your mind is on it already, and then you're expressing it, yeah, together with your body. So meaning to say it will actually give you a lot of benefits.
Mm.
Okay, because it's like exercising,
Yeah.
because you're expressing yourself. Yeah, by doing it's like also yoga, right? Because you don't have naman, you know what, El? A lot of people are actually thinking that when we think of bodily movements, especially if we wanted to have a good mental health, and then when we say it's actually a practice of you have to move for you to really to boost your system to boost your happy hormones, but it's not always what you call that, a kind of exercise that are very that requires a lot of movements.
Absolutely.
Simple movements can do, just like yoga, just like meditation, just like expressive art therapy, because your hands are moving. You can also do the dance therapy. You can also, by just listening to the music, how can you apply that? You
Mm.
just close your eyes, you listen to the music, and then you can move your body according to the music. So meaning to say, so that's really how that's the importance of the creative therapy at home, especially during nowadays that we're experiencing this kind of concerns with COVID. Okay, so I forgot, but I want to mention this one. Of course, uses of art therapy. I forgot. I already forgot. So this can be used with a wide range of mental disorders. Of course, psychological distress. Do we still have time, love?
We've
Yeah.
got about, I mean, we're on our cap, but I want to hear this.
Okay. So last but not the least, okay, of course. So I'm going to yes. Okay. So how it works, because art therapy is also actually used in a variety of art methods, including the drawing, the painting, the sculpture, the collage. Okay. Usually this is being used in inpatient inpatient offices, private mental health clinics, schools, community, organizations. All are possible settings where you can use the art therapy. And also, you can also use this in art studios, colleges, universities, hospitals. Okay. And then people often wonder how an art therapy session differ from the average art class. So that's the question. So where an art class is focused on teaching techniques on creating specific finished product, okay, an art therapy or an art therapist is more about letting clients focus on their inner experience. So that's the difference. Okay, so that's, I hope that's one of your best takeaway in terms of psychotherapy and other psychotherapies, the art therapy, and a lot more. Okay, maybe next time we can have focus lang on types of creative therapies.
Yes, absolutely.
Okay, yeah. So in creating art therapy, so people are able to focus. It is important to focus on their own perceptions, yes, imaginations, feelings, because clients are encouraged to create art that expresses their inner world. Yeah, that's very important. More than making something that is an expression of outer world. That is why I love art therapy, because you can pour out your thoughts, your innermost thoughts in art therapy. Okay,
I think that's one of the
beautiful
things that you mentioned is being able to express, and maybe a lot of us are not able to express freely because we are held back by a lot of different preconceived notions we have, or what will this person think of me, and so we end up chameleonic a little bit. We end up reshaping ourselves in different ways in front of different people in different environments, especially at work and in front of people, because we want that acceptance. We want to feel good. We want to be good enough. And so we get into the habit of adjusting ourselves, wherein again, with everything, we need balance. And so creative art therapy and expression allows us to bring that balance from the habitual striving to be good to just expressing what actually is. And the more we express what is, the more we can begin to appreciate the beauty, even in the imperfection. And then it becomes fun.
Yeah. Awesome. And also, of course, after the therapy, for some audiences here, you can also, of course, in order for us to treat the anxiety and depression, we can also take the medicine. Okay, so of course, we have that questions before, diba, that how are we going to prepare in terms of, yes, our audience are actually ready for, say, visiting a psychologist or psychiatrist. So how do you prepare? So first, you have to find a therapist, because get a referral from a doctor or a health insurance. And then, but basically you have to understand the cost, because for others, kasi if you have that health insurance, you will not find it something certain. Psychotherapy, of course, it will take something years. Okay, it depends on the concern. And then, of course, lastly, you have to review your concern first. Okay, before your first appointment, you have to think about what are your issues you would like to work on, okay? Because while you can also sort this out, your therapists are actually having some sense of in advance, okay? That can be provided as your starting point, okay? Of course, you can also check the qualifications of your therapist, and then have a good expectations for your first session. It's how your first session will say take off. Okay, of course. I want to mention this one, types of psychotherapy, because we have a lot. We have the CBT, I mentioned that already. We have actually the dialectic behavior therapy. Okay, for the dialectic behavior therapy, because this one, a type of CBT that teaches behavioral skills, okay, to help you handle stress, manage your emotions, and improve your relationships with others. And also, part of the therapy, we also have what we call the acceptance and commitment type therapy, because which helps you become aware of and accept your thoughts and feelings, and commit to making changes, increasing your ability to cope with and adjust to situation. That's a must. Of course, I mentioned this already. We have what we call the psychodynamic or the psychoanalysis kind of therapy, wherein the focus is more on the increasing your awareness or the unconscious part of our brain or our thoughts and behaviors for us to have what we call that, develop our insights into motivation, so we can on our own we can resolve our own conflicts. And we also have what we call the interpersonal psychotherapy, because that interpersonal psychotherapy, this one focuses on addressing problems with your current skills and how you can relate with other people. Okay, so that's really the psychotherapy. Okay, so okay, what's my take home message na lang?
Well, let's just do a quick recap of the pardon?
Yeah, I thought this is actually 3 hours.
No, it just means we're gonna have to go back into it. As you guys can see, there's so much that goes into this, and so it really, when we're at home and we're feeling isolated and we're feeling hopeless, as Dr. Agustin has said, you know, there's a lot of different resources that we can visit and entertain without having to go through the route of medication, if that's what you choose. So, you know, that community support, but being able to, I think, out of everything that we've learned from the different coping techniques and the different exercises of psychotherapy, at the end of the day, it all comes back to self-awareness. We do not need anything to make us better, anything outside. Everything that we seek is already within us. And so to find out if everything that, what does that mean? If everything I seek is within me, then why don't I feel good? Maybe because we haven't taken the time to really get to know ourselves. And so I invite you all to use this as an inspiration, as we see Dr. Ellen and Agustin working with all of these people, and the beautiful things that this practice has produced. It's allowed people to discover themselves truly. And when we discover ourselves truly, a natural manifestation will be that we're able to accept and release all the different hindrances that we've always carried along with us. And there lies, you know, that peace of mind that we all so earnestly want, especially during crisis and adversity. So, Dr. Ellen, can you leave our participants with something? I think the most important, most powerful thing is hope. And what can we hope for?
Okay, so, but of course, so this is important. Okay, so not all psychotherapeutic treatments are actually comparable in terms of proficiency. So take note of that. And performance, however, when appropriate diagnoses are made, empirically supported treatments are undertaken. So psychotherapy can be enormously beneficial in the treatment of diverse kind of psychological health issues. Also, exploring negative thoughts and emotions through psychotherapy, yes, it is understanding the potential impacts they have on psychological health. So, meaning to say, we can help reframe our thoughts and behavior in order to improve our mental health condition. And I actually have one last one, Elle, so may hear it pa. Okay, so I would like to share this with, this is my favorite quotes, Elle, because this is with the topic today. Okay, so remember this one. So never let the sadness of your past, okay, and the fear of your future ruin the happiness of your present. So that's it. Thank you, everyone. Thank you, Elle.
Thank you so much, Dr. Ellen. I love that. Never let the fear or the sadness of your past or the fear of your future take away from the present. I think more than anything, when we're experiencing so much uncertainty, it's natural for the mind to try to analyze, because we need to make sure that we're okay. But let that not take away from the right now, because at the end of the day, today is tomorrow in the making. And what we do in the present moment, what's right in front of us, the people that are right in front of us, that are maybe not right in front of us, but the people that we have access to, the roof over our heads, the breath in our lungs. When we focus our attention, and where focus goes, energy goes. When we focus our intention on the present and what we do have in gratitude, we'll be surprised the light that comes in and the perspective and the big picture that we're able to see. But remember, there is strength in meeting others. So ladies and gentlemen, if you're listening to this and you understand, you don't know where to start, and maybe you need a little extra support, this is why we've created this platform, is to bridge the gap between you and the answers, between you and the professionals and the framework and what we're going to do with this workshop series. As you've seen, we're taking all of the expertise like Dr. Ellen and professional coaches and athletes and doctors, so that we can give you this information, but also to provide you a community support system. So if you would like to be part of this, if you would like to be part of a program where you have support and accountability, where you have like-minded people who are earnestly trying to improve their well-being as well, and if you'd like that extra help and that guidance and maybe a little bit of excitement to add into your day, we hope you'll join our interactive workshop series called Breakthrough in Action. Our first class starts on Wednesday the 29th. Guys, this is completely free. This is 100% free and complimentary in order to support you and any of your friends and loved ones who you think might benefit from this initiative. So we want to thank you so much for tuning in. Dr. Ellen, you are amazing. We're going to have to do another session because I know like you barely scratched the surface and I want to hear more. Thank you so much for sharing. We really appreciate that. The community appreciates it. Everyone from Trifactor Engage, we'll see you at Breakthrough in Action next week. Excited. Have a good one. God bless.